How are you doing today, John?
I'm doing well. How are you doing?
Doing good, thanks. My name's Derek. I'm a student physical therapist working under Dr. Clausen today, and he informed me that you had an ACL reconstruction, which I probably could have figured out based on this massive scar you have right here.
Yeah, it's a doozy.
Is it?
A doozy, yeah.
How long ago did you do it? A couple weeks? Is that what I remember?
Couple weeks, yeah.
Yeah. So how's it feeling today? Is it pretty sore?
Yeah, it's pretty sore. Mostly just stiff and weak, I feel like.
Gotcha. Okay. Yeah, and that's kind of what Dr. Clausen mentioned too. He said you've got some quad strength weakness right now. So he asked me to come in to set you up on some electrical stimulation, and that's going to help to strengthen your quad muscle again, okay?
Nice.
So basically how electrical stimulation works, I'm going to take these pads, I'm going to put them on your quad, and obviously me doing that is going to require me to touch your leg and to place the pads and stuff. Is that okay with you if I do that?
Yeah, whatever you need.
Awesome. So we're going to do that, and what it's going to do is it's going to send like a little electric current kind of through your muscles, which sounds a little scary, but I promise it's not. And what that's going to do is we're going to try and get it to activate the motor neurons in your leg to make the muscle contract without you having to like voluntarily contract, if that makes sense. Yeah. And what that's going to do, because you've got some weak quadriceps and because of your surgery, it's hard for you to voluntarily contract right now. That's going to help you like get better at voluntarily contracting and also keep the muscle strong while you're healing, if that makes sense.
Yeah.
So that's kind of the goal of what we're going to be doing today. Could I have you like roll up your shorts for me just a little bit, just as high as you're comfortable with?
Yeah.
As John's doing that, the indication I mentioned earlier for why we're doing this is we're trying to keep that those quad muscles from atrophying after his surgery. So the E-Stim I'm going to be doing is biphasic pulse current, NMES, to activate those motor neurons in his quad. So it's a bit of a stronger pulse, stronger than just for pain control. But we're going to be making it so he can contract involuntarily there. Perfect. I guess some contraindications would include if he's pregnant. We were doing this in abdomen or back area, I guess. If you had any open tissue wounds or I guess pacemaker as well, cancer, malignancies, maybe a joint replacement, just different issues like that. So John, do you have any, do you have a pacemaker?
No pacemaker.
No pacemaker.
Mm-mm.
Any, have you had a knee replacement before? Probably not, because you just had an ACL surgery. But
No, never had a knee
nothing
surgery
like that. I don't
before.
see any problems on your skin. I don't see any rashes or cuts or anything. Do you have any history of cancer or tumors at all that you know of? Nothing like that? Okay, perfect. So knowing those things, I would continue to proceed. So John, what we're going to do is first, I'm going to place these pads on your leg, and they might be a little cold, which I apologize for. But I'm going to put this first one kind of up a little higher on the quad, trying to target the rectus femoris muscle. My hands are a little cold too, sorry about that. It's a little chilly, yeah.
It's not warm.
Yeah, I apologize.
Yeah, no, you're good.
And then this other one I'm going to put a little lower on his leg. In real life, John would have a scar, so I just want to be careful not to go too far over that scar. But I would still try and go a bit lower to try and get as much of that muscle contracting as possible. Does that feel comfortable?
Yeah.
Feel okay?
Yeah, no problem.
Perfect. So now if you want to come on over on the machine, since we're doing biphasic pulse current, I'm going to select biphasic over here. We're going to do just normal there. For the duty cycle, normally you want to get 10 contractions, and you could do that in 10 minutes by doing 10 to 50, because that's 10 minutes on, 50, or 10 seconds on, 50 seconds off. But for the sake of the video, we're just going to do 10 seconds on, 10 seconds off, because he just has to do 2 contractions. The ramp up time, we can, especially because it's his first time, put it at 2. That just is the amount of time it's going to ramp up to that max contraction. So we could do that because it'll make it a little more comfortable for him. Now we're going to come over to time. Time's at 10 minutes that I already mentioned. The rate, we can leave at 50, but anywhere between 50 to 80 is okay for that, to hit those motor neurons. The width being at 200 is good as well, but you can go anywhere up from 200 to 800. So we're good to go there. And then I can turn the intensity up. And in this case, what I'm going to tell John is we want the muscle to contract about 60 to 70% of the maximal contraction. So like a good strong contraction, but not so strong it hurts him or gives him pain or anything like that. So going back to John, so I'm going to be turning up the intensity on this machine for you. And we want the muscle to start contracting, but not contracting so hard it hurts you, on about 60 to 70% of your max muscle contraction.
Okay.
So when I start doing this, you'll start with feeling a bit of a tingling, and then you'll progress into that muscle contraction. So I just want you to kind of let me know when the tingling happens, and I'll kind of ask you questions as we're going, okay?
Yeah, cool.
So start going up. Feel anything yet, John?
Not yet.
Nothing yet still?
No.
Okay.
Oh, I'm starting to feel the tingle.
A little bit of a tingle? Okay. So normally I would ramp him up quick once I kind of know what he's going for, but since it's his first time, I go slow to make sure that we can get to that right level. So his nerves might adjust a little bit, in this case, the beta nerves.
Tingling's getting stronger.
Is it?
Yeah.
I'm going to go till you can get that contraction. How's that, John? Your face is grimacing a bit, so...
No, I'm just smiling at it. It's interesting. I feel like I can feel the muscle starting to contract, but it's not like
So
doing
it's just
any twitching
twitching.
or anything.
Got,
Yeah.
okay. Keep going higher then. Make sure that John is doing okay. John, you are doing okay, right?
I'm feeling good.
You're feeling good?
Yeah.
You feel like that's something you can do when you come into therapy to get that quad strong?
Yeah. Yeah.
Good. I'll remove the pads from him. Hopefully without ripping too much leg hair. If John would just shave his legs, that wouldn't be an issue.
Forgot today.
And then I would go and report to Dr. Clausen, and we continue with treatment.